Hi, I'm Mary, and I'm going to be talking about the use of stem cells in reconstructive surgery. To begin, a stem cell is a primal, undifferentiated cell from which a variety of other cells can develop. When talking about stem cells as are used in reconstructive surgery, there are three main types: induced pluripotent stem cells, iPSCs, adipose-derived stem cells, ADSCs, and embryonic stem cells. iPSCs are somatic cells that have been reprogrammed to an embryonic stem cell-like state. ADSCs are a type of somatic stem cell that resides in adipose tissue. Meanwhile, embryonic stem cells are obtained from the inner cell mass of the blastocyst. All three kinds of stem cells listed are used in stem cell-based therapies, which offer the possibility of a renewable source of replacement cells and tissues to treat diseases. One of the worries with stem cell therapies is that the use of rapidly dividing, differentiating cells will lead to an increased risk of tumors and cancer formation. One of the most prevalent uses of stem cell-based therapies involves the use of ADSCs for breast reconstruction after mastectomy. Thus far, there is no clinical evidence that the use of stem cells in breast reconstruction results in a higher risk of tumor recurrence and cancer formation in lipotransfer patients. Because breast tissue is primarily composed of fat cells and adipose tissue, ADSCs from other parts of the body can be transferred through liposuction to the breast to produce a more natural-feeling breast tissue than other forms of reconstruction. This method helps alleviate the emotional strains of mastectomy on women. However, an even more exciting use for stem cells is in the treatment of burn wounds. Burn wounds can lead to the loss of skin integrity. Skin integrity protects us humans from water loss, temperature change, radiation, trauma, and infection. In adults, healing burn wounds typically manifests as fibrosis and scarring, the common treatment for this being analogous skin grafting. Unfortunately, donor sites for patients with large burns are limited. Fortunately, there are artificial skin substitutes available, but wound contraction and scar formation are still unavoidable. Currently, the substitutes containing stem cells temporarily prevent the loss of body fluids and bacterial infection, while also achieving satisfactory repair work. If used properly, stem cell therapy could improve the quality of burn wound healing and allow the burn site and its appendages to return to normal. The most effective cells for this treatment are embryonic and adipose-derived stem cells. As could be expected, there is opposition to stem cell research because many people believe that all stem cells are embryonic. This is obviously not true, and steps should be taken to correct this idea, as many life-saving treatments can be derived from iPSCs and ADSCs. Reconstructive surgery has come a long way since the patented meter flap surgery of the 1840s, and is now being revolutionized with stem cells. There's no telling where the future of this surgical concentration will go, but for now the most promising thing on the market is stem cells, grown naturally and organically in your very own body.